Our first panelist is not new to us because she had spoken during the first day. She is the supervising health program manager of the Disease Prevention and Control Bureau of the Department of Health. Without further ado, to speak on the topic MMS, or multiple micronutrient supplementation policy and plans, no, please give our warmest appreciation to Miss Luz Tagunicar.
About the multiple micronutrient supplementation for pregnant women. Okay. In the previous discussions, we focus our attention on the nutritional status of children in the Philippines. But this time, we're going to focus our attention on the prevalence of nutritionally at-risk pregnant women. So by age group, if you can look at this, this is the different results or findings of the National Nutrition Survey 2015, 2018, and 2019. So if you can look at the slide, look at the prevalence of nutritional at risk among less than 20 years old. So it's very important that we focus our attention to our adolescent, no? Yung ating teenage pregnants. So they are the most vulnerable and they are the most nutritionally at risk. For those more than 20 years old, this prevalence has reduced or has a lower prevalence, but it's still a public health concern, no? So overall, in 2019, we still have 22.9 of our pregnant women that are nutritionally at risk. So we know the consequence of a nutritionally at risk pregnant woman, that she might be able to have a not very good birth outcome. So it could lead to low birth weights. It could also lead to birth defects. Okay. For micronutrient supplementation, it's very important that we look at the anemia status of pregnant and lactating women. So if you can see the trend here, this is all based on the National Nutrition Survey, no? Series of National Nutrition Survey conducted by the Food and Nutrition Research Institute. So from a very high of 50.7% or almost half of our pregnant and lactating women are anemic, no? So that was in the year 1998. So we strengthened our iron and folic acid supplementation, and we were able to reduce the prevalence of anemia among pregnant and lactating women to 19.9%. But if you can still see it, it's still at the moderate level. So we still have some problems, and we need to continue our supplementation. So this is important as pregnant women, as I have said, if they're anemic, they can give birth to low birth weight babies, or could lead to some birth defects in the future. So as I was saying, an anemic woman could give birth to a low birth weight infant or to a stunted infant. So if you can look at this slide, if you can see the upper left or the lower left, no? At 0 to 5 months, we are already at 12% stunting. So meaning the child is already stunted inside the womb, or the child is already having intrauterine growth restriction because of the poor nutrition of the mother. So it is very important that we look at the stunting on the first 2 years of life, no? Because after 2 years, some of the effects of stunting is irreversible, particularly the one that focus on the brain development. So that's why we focus our attention on the first 1,000 days, beginning from preconception up to 2 years of life. Okay, so that's why the Republic Act number 11148 or the Kalusugan at Nutrisyon na Magnanay Act was passed by Congress. This is through the advocacy of Department of Health, National Nutrition Council, and all advocates on maternal and child health. You know, this law is an act scaling up the national and local health and nutrition program through strengthening strategy. So we know for a fact that in the past years, we are focusing our interventions more on the infants and the children, but we forget that the the birth outcome or the nutritional status of our infants and children is highly dependent really on the maternal nutritional status. So this law uh, really looks back at even at the preconception or even at the adolescent stages because they will be the future mothers. So we have to look at the nutritional um, well-being of adolescents and women of reproductive age even before they get pregnant. So why the first 1,000 days? Undernutrition in the first 1,000 days is largely irreversible and can be fatal. So potentially irreversible effects on intellectual performance throughout life. So sabi nga natin, a child that is stunted is also having poor performance in school and poor mental development. So there's lower physical work capacity as adults and poorer school performance throughout adolescence. And it increases the risk of deadly infectious diseases like diarrhea and pneumonia. So even if the child survive, the risk of having deadly infectious diseases becomes higher if the child is stunted. And then there's an earlier onset of chronic degenerative diseases in adulthood. So we know that the nutritional status of the child will mirror the kind of nutrition or health status that child would be in the future. So we say that overweight and obesity and early onset of chronic non-communicable diseases is due to undernutrition of the child. So, how can the law or the first 1,000 days affect the nutrition of the mother and child? So, the law is specific that we need to do some interventions even in the preconception and pregnancy. So, this is where we focus on the life course intervention. So, starting from the preconception and pregnancy to adulthood. And then, of course, as we used to do, we also look at the neonatal, infancy, and preschool nutrition, health and nutrition of our children. So it's going to be a holistic approach from even before birth up to 2 years and beyond, so that we will be able to cut the intergenerational cycle of malnutrition. So currently, we have evidence-based interventions for pregnant women in the Philippines. And these are just some of those related to nutrition, but there are other things that is embedded in our policy for quality antenatal care. So those that are referring to nutrition would be screening for anemia, supplementation with iron and folic acid. So right now, our supplements is iron and folic acid. Of course, information, education, and counseling. So we have now guidelines on how to monitor the nutritional status of pregnant women. And we are starting supplementing energy and nutrient-dense food to pregnant. So the National Nutrition Council discussed on the first day of this webinar or that they have tuto kainan wherein they are feeding pregnant women. And as on the part of the Department of Health, we are buying ready-to-use supplementary food for pregnant women for nutritionally at-risk pregnant women. So this is a high energy and nutrient-dense food containing 500 calories and of course, a lot of micronutrients. But these are only focused on the nutritionally at-risk pregnant women. We have also screening and management of diabetes mellitus, promotion of exercise, and of course, it's very important the promotion of iodized salt consumption because we know that women with deficiency in iodine might uh, give birth to a child with poor mental development. So, okay, in 2020, the World Health Organization came up with a new recommendation, and this is, they have a very high recommendation on the use of multiple micronutrient supplements that include iron and folic acid. And of course, this should be context specific, meaning if the country can afford a switch from iron and folic acid to multiple micronutrient supplements, and also based on the status or the conditions or the nutritional status of pregnant women. So the multiple micronutrient supplements in pregnancy, the recommendation have critical remark. Like many multiple micronutrient supplements contain 30 milligram or less of elemental iron. So I think the Unimap formulation contains 30 milligram. So we should not go below 30 milligram when it comes to iron. As I have shown in the previous slide, that we still have a moderate level of prevalence of anemia in the country. The WHO also recommends antenatal iron and folic acid supplementation containing 30 to 60 milligrams of elemental iron, with 60 milligram preferred in populations with severe public health problem of anemia. So I think in the past, as I have shown, more than or about half of our pregnant and lactating women are anemic. So we have a severe problem of anemia then, but we were able to reduce it to moderate. So the 30 milligram milligram elemental iron contained in Unimap formulation can be acceptable within our context. And then countries should consider their population magnitude and distribution of anemia. So its nutritional determinants as well as the magnitude and distribution of low birth weight. So since we are reducing also our prevalence of anemia, we were able also to reduce the prevalence of low birth weight. So in the last National Demographic Health Survey, we were able to reduce low birth weight from the high of 21% to 15% in 2017 NDHS. Okay, so why multiple micronutrient supplement? Because it meets the daily micronutrient requirements of pregnant women, where many are nutritionally at risk and quality of meals are poor. The National Nutrition Survey results in our the food security component is saying that the Filipino diet are becoming poorer and poorer in quality. So the diversity is lesser, and of course the quality. In the last National Nutrition Survey, very low prevalence of Filipino household are really meeting all the required nutrient requirements for the day, no? So and it's very is of concern because our pregnant women should be getting all the necessary nutrients during this stage. So we need, and also the FNRI Philippine daily requirements for the day is saying that even if a pregnant woman consume foods that are high in iron, those coming from the food cannot really suffice or meet the requirements for the day. So there are only two conditions where micronutrient supplementation is really required for iron, is that during the menstruation period or yung adolescents natin during their when they are menstruating, and of course for pregnant women, you know. So the multiple micronutrient supplements based on several studies, no, And probably Dr. Jojo Huguan would later on show you some of these studies. These are the basis of the recommendation of the World Health Organization that it yield positive pregnancy outcomes over and above IFA, no? Because MMS is complete in micronutrient supplements, and while IFA is only on iron and folic acid. So the MMS is safe and effective across settings, and it fills the equity gap in the quality of care, because right now only those in the affluent sector of the society can afford multiple micronutrient supplements being prescribed by their OB-GYN or their obstetrician. Okay, so this one will be discussed in detail later by Dr. Jojo Huagan. But based on cost effectiveness study in the Philippines, transitioning from IFA to MMS will mean it will avert 590,505 dollars. It prevent the deaths of an additional 5,162 children, yield benefits that are 463 times greater than the cost, and be considered very cost effective according to the World Health Organization guidelines. So transitioning to MMS leads to significant effect on the perinatal health outcomes compared to IFA, with no harm to the mother or baby. And so the transition, according to the recommendations, is very cost effective, and it will yield a high return of investment. Okay, but the transition would have some challenges or consideration. So first is cost. Although multiple micronutrient supplements is ideal, it costs more than the IFA. So later on, with the Mandanas ruling, some of these MMS will be transitioned to the local government units. So the challenge would be, will the local government units be able also to procure MMS, which costs more than the IFA? Because currently, very few local government units are really procuring these commodities for their pregnant women. And then equity, MMS should also be made available to all pregnant women, especially those that are marginalized. So sabi natin, hindi lang dapat pangmayaman ang multiple micronutrient supplement. It should be, the more that it should be given to poor women that are marginalized, because they will be the one, they are the most at risk, and they will be the one that will have poorer birth outcomes in the future. Acceptability, if it is free, it will be acceptable. And I think it, based on our studies, it is, well, some feedback and not yet really backed up by real research, is that they are more acceptable because of the taste, no? Some of the pregnant women really are not accepting the iron and folic acid because of the taste. And then, of course, the feasibility. MMS supplies in the country is sourced outside the country by NGOs or UN organizations like UNICEF, but not yet commercially available in the country. So this one, we really need to look into that and to make it more accessible to our pregnant women, and will be made available in the country. Okay, so what are the ways forward? The Department of Health, together with the UNICEF, Nutrition International, and of course, Vitamin Angels, would conduct an operational research on the feasibility and acceptability of the multiple micronutrient supplements in pilot areas in the country. This would provide us a local evidences on that would support the policy development for inclusion, or the switch or the shift from iron and folic acid to multiple micronutrient supplements. And then inclusion of MMS in the updated manual of operations of the Department of Health. So we started to include it as one of the policies. And so this manual of operation is still for review of the various DOH units and the executive committee. And then request for the inclusion of MMS in the Philippine National Drug Formulary. We know that the Department of Health as well as the local government units cannot procure MMS if it's not included in the Philippine National Drug Formulary, or we call it the list of essential drugs in the country. And then well, the Vitamin Angels offered their help also to work for the availability or production of MMS in the Philippines following the UNIMAP technical specifications to make it available in the country. And then, of course, when we switch, we need to conduct massive information campaign on the shift from IFA to MMS. I think that's the last slide. And before we have the ship, we need to do a lot of work yet to be able to do this. Thank you.
Thank you, Ma'am Luz. Indeed, it's really an exciting to hear from the Department of Health the policy and the plans on MMS. And we know our partners are really excited to hear more about this in the coming days and months.